So insulin resistance is a state in which insulin, which is normally produced in the body, or is producing subnormal insulin response to the glucose metabolism. Now, insulin receptors that are present on cells are unable to bind properly to the insulin, thereby not reacting well to the insulin that is present in the body and unable to process the glucose well. Now, let me simplify it further. Think of insulin as a key that opens up the cells to take in the glucose that is circulating in the body after a meal, to move it from the blood to inside the cell. Now, when our key, the insulin, is not working properly or is unable to unlock the cells to shuttle the glucose in, that is what is called as insulin resistance. Insulin resistance is fairly common these days, especially in India now that we are becoming the diabetes capital. We commonly see it in the age group of 20 to 30 and even beyond that. But 20 to 30 is in fact the age where I encounter it the most. So I would say minimum 5 out of 10 people do develop it. The early signs are actually most patients are asymptomatic when we talk about insulin resistance. Most of the times it is something that is accidentally picked up by the physician. So there can be increased triglyceride levels, there can be fatty liver, there can also be increased A1C levels. However, there are very few other signs per se. However, in advanced insulin resistance, there can be skin tags on the neck and armpits, there can be acanthosis nigricans. There can also be increased fat deposition on the arms, around the belly, also called as an apple-shaped body, which is commonly associated with insulin resistance. Insulin resistance, basically when the key, our insulin, is unable to unlock the cells, pancreas produced more insulin in order to help unlock the cell. And in early stages of insulin resistance, they manage to do it. So there is increased insulin production, which unlocks the cell. Glucose is pushed into the cell, shuttled into the cell, and the glucose levels will be normal. So when you check the A1Cs or the sugar levels, they are likely to be normal. It's only after a few more months or years that this gets converted to the prediabetes stage. This is even before prediabetes that insulin resistance develop, which can head towards prediabetes and then furthermore diabetes. So they are not the same. Insulin resistance can be caused primarily due to 3 main reasons. That's genetic, immune, and metabolic. Okay, when we talk about genetic, it can be due to multiple conditions, but there's type A syndrome, which is commonly involved. When we talk about and its variants, and immune systems involved, such as type B syndrome, which has anti-insulin antibodies and anti-insulin receptor antibodies. And then there is, of course, metabolic, which is the commonest, in which there is type 2 diabetes. People who have parents who are diabetics or siblings who have diabetes running in the family, they may be prone to insulin resistance. Obese patients are very, very prone to insulin resistance. Patients who have high glucose levels, who have a very carb-rich, very synthetic diet are at a risk of developing insulin resistance. It's also epigenetics, that is how one's genetic constituent reacts to the environment. So a person may be genetically very good, no syndromes as such, but the diet that they are consuming, the lifestyle, the sedentary lifestyle that they have can make them prone to insulin resistance as well. Insulin resistance is more or less a clinical diagnosis, and but then there are a few blood tests that can help us in picking it up earlier. However, we don't entirely depend on the blood work because, as I discussed, it is much later that A1C levels may be, may differ, or the triglyceride levels might be abnormal. So insulin resistance, if we see a patient with, men with a waistline of over 40 and women of over 35 inches, we do tend to think of insulin resistance. Anybody with a genetic history of any kind of metabolic disorders or type A syndrome, we do consider insulin resistance. Also, so when we talk about testing, primarily it is the fasting lipid profile, it is A1C or HbA1c levels, and fatty liver. So on sonography, we do pick up a fatty liver. These are some tangible tests that we do, but more or less insulin resistance is a clinical diagnosis. Also, serum insulin levels can be measured, which are likely to be high in cases of insulin resistance. So, this is gaining quite a lot of popularity now. Checking the insulin levels and triglycerides can help in picking up early signs of insulin resistance. So there are certain conditions such as polycystic ovarian disease, which is commonly again associated with insulin resistance too. Now, in certain patients where all kinds of lifestyle modifications have been tried and yet they are likely to progress towards resistance, there are a few drugs which are in trial as well right now, which help in cutting down obesity, which are being tried for insulin resistance too. Insulin resistance, all the extra insulin that is circulating in the body because of resistance, in patients who have not yet developed diabetes or other metabolic conditions, insulin tends to cause other side effects too. First of which is hunger. Second is weight gain. Third is deposition of fat and inflammation. So you see, this becomes a vicious cycle. Anybody with insulin resistance is likely to have extra insulin in the body, which is going to cause hunger, weight gain, excess fat storage, and inflammation. So they land up eating more carbs and more sugary foods in order to curb that hunger, which again gets converted to fat and insulin, makes them obese and makes them more resistant. So this becomes a vicious cycle. Now, insulin resistance is also a base for other metabolic disorders. So thereby it is something which can result into many complications, but in itself, it doesn't cause many complications. It can result in other diseases which can make life very complicated. Insulin resistance over a period of time causes a defective beta cell production of insulin. Thereby, there is reduction in the production of insulin, resulting in increased level of glucose and thereby type 2 diabetes. The story doesn't just end there. Because of years of insulin resistance, even when we put the patient on a treatment for diabetes, they are likely to be a lot more resistant towards improved glucose levels because of the lack of insulin that the pancreas is producing, or the lack of receptors for insulin binding. In such cases, we need to use insulin sensitizers. So insulin resistance most often converts into diabetes mellitus. It is the stage before diabetes or pre-diabetes is developed, where things can be managed and turned around. Lifestyle, in fact, is the key to managing insulin resistance. Any amount of activity, even 30 minutes, ideally it should be 45 minutes, but even 30 minutes of cardio exercises and a healthy, balanced diet, the most helpful in managing insulin resistance. So I would say 45 minutes of exercise 5 days a week minimum, a good healthy weight, a good BMI, a good wholesome diet, whole grains over processed grains, whole foods, good amount of fruits and vegetables, increased fiber intake, a healthy hydration level. These should be good enough to manage insulin resistance.